today is a really special day. And I'm not sure whether you'd call this advocacy or outreach. I think it's just us. It's AARP and our wonderful volunteers. Medicare and Social Security are such signature issues that in so many ways have defined AARP over the decades, really. And those two issues are what we are talking about today. And of course, you folks are absolutely integral to this entire initiative. These conversations that are going to take place over the coming months really are all about AARP's commitment to honoring independence, choice, and control for people of all ages.
The biggest issue facing AARP, as Jim said, for years, has been Medicare and Social Security. They are bedrock programs. They keep us old folks out of debt and healthy. They are part of what makes America great. AARP is the bulwark for protecting Medicare and Social Security. If it weren't for AARP, Social Security would have been privatized years ago. We all know that. Medicare would be a voucher system. You've heard that one. It's we who are stopping that. Our members, everyone 50 and above, and future generations rely on AARP to protect and strengthen these programs. We call this effort You've Earned a Say. Here's what it's about. Number one, to help Americans get the facts on Medicare and Social Security. And as I said, I will be doing some of those facts for you a little bit later this morning. How those programs work, who gets what kind of benefits, how the benefits are paid for. Second, we want people to decide for themselves what they think should be done. There will be a lot of choices facing the Congress next year and whoever is president. We want people to understand those choices. And third, to make their voices heard loud and clear in Washington.
Good morning. I'm Brian McGuire from AARP New Jersey. Thank you for joining us today and participating in this town hall meeting to talk about the future of Medicare and Social Security. For the last year, some politicians in Washington have been talking behind closed doors about making changes to Medicare and Social Security as part of a budget deal. We don't think that's right. AARP members in New Jersey and across the country joined together to stop cuts in Medicare and Social Security benefits last year. We strongly believe you've earned those benefits through a lifetime of hard work, and you've earned a say about the future of these programs. We're here today because we believe it's time to take the debate about Medicare and Social Security out from behind closed doors in Washington. That's why AARP is launching You've Earned a Say, so you can make your voice heard on the future of Medicare and Social Security. How confident are you that Social Security will be there for you throughout your retirement? 26% of callers, that's 225 people, are very confident that it will be there. 48%, almost half, say that they're somewhat confident. And 22%, over 200 people, say they're not confident at all that Social Security will be there throughout their retirement. And about 5% of people don't know.
My concern is that they keep borrowing from Social Security. Our generation is already in a problem, but the next generation coming up, I fear for my kids, because it's a mess now. What's going to happen if they keep taking? You can only take so much from the pot, and then there's nothing left.
I believe that they ought to give us an opportunity to have a fund to increase our own benefits by having a fund to contribute to as we're retired. And they ought to make it so that, as with retirement programs from work, that they can't dip into these funds. It's outrageous.
The first Medicare question is, how important would you say Medicare is to your health in retirement? 92% of people on the phone say that it's very important. 5% say it's somewhat important. No one, well, 3 people, but close to 0%, out of these hundreds of people say that it's not important at all, and 15 people, about 3% of people, say that they don't know.
One of the comments I hear many, many times is that in the issue of health care reform, that if Congress only got their health care reform the same place they are mandating that everybody else get it. Well, those of you like me who are on a private policy, we're going to stay where we are with healthcare reform. But as you know, there are going to be healthcare exchanges from which people who don't have insurance otherwise will be buying their insurance. And I want to make sure everybody knows that members of Congress will be required to get their insurance from the same place that is in the healthcare reform bill.
The question is, how confident are you that Medicare will be there for you throughout your retirement? About 16% of people are very confident that Medicare will be there for them when they retire. 43% are somewhat confident, they're really not sure, a little bit confident. 36%, more than a third of the people on the phone, are not confident that Medicare will be them throughout their retirement. And about 6% of people don't know.
Medicare is just one of the many aspects of the health system in this country that needs to be fixed totally. In my opinion, healthcare is a right, not a privilege. And as one who didn't have health insurance for a long time while I was freelancing and not getting credit, I can tell you it's a horrible thing to not have any insurance, and I'm very grateful that I now have Medicare and Social Security, but I am concerned about the rest of the country.
I am a relatively recent recipient of Social Security. I'm 67. I've been self-employed for most of my life. I am in a position, given the economy, where I seriously envision living out my life at some point, alone on the street without an income. I have not been able to afford to put away. Well, there's been nobody to put away a retirement package for me, and I've paid my own insurance. I can't afford to get long-term care insurance.
I was just wondering about the Social Security. They want to decrease it, but I can't live on the income that I get now. I mean, I am depending on low-income help, like housing and food stamps and everything, because my income is $20,000. It's like, and if I have any more money in my account, I lose all the extra help that I get for low-income people. I mean, I worked all my life. I'm 65 years old. I've been an RN for over 20 years. I've helped people, and now when I'm in the position of getting help and needing help, I'm out there in La La Land because there's nobody to turn to.
We've been working on Medicare fraud now for a while, and they have put in more people to fight it. And at all of our meetings, we ask every month for everybody to please check their forms and call in again. But when we read in the paper, it doesn't seem like they're getting too effective. When they take these people to court, I'm not seeing that the money's coming in again.
Okay.
And we're going to need that money recovered to keep our Medicare costs down.
Well, I do believe that we have to, AARP and people in general have to make more publicity concerning the cost of health care is what has devastated Medicare.
Yes.
And people may not fully understand that the cost of health care has to be put under control.
To be eligible for Medicare, you have to choose your drug insurance. You have to have that. Otherwise, you will be penalized. I thought I was saving the government money. I did not enroll for the drug for a year. I was penalized, and I asked, how long will I be penalized? They said for life.
I want everybody to know what I got out of today personally. I think this is going to work. I think when we listen to the amount of energy and commitment everybody has and the number of people who are willing to pitch in, I think we have a really good chance of influencing this discussion for good as the year goes on.
Once again, AARP thanks everyone who's joined us today. Over 9,000 people on the phone, hundreds of people on the internet, a room full of volunteers here in Princeton. We want to say thank you for participating in our forum today on the future of Medicare and Social Security.